I'm Raj Dave at C3 2018 in Orlando, Florida, and I have a great privilege to have some distinguished guests with me today. To my right is Dr. Fayaz Shawl, who just received the C3 2018 Legend Award. He's the Director of Interventional Cardiology at Washington Adventist Medical Center in Maryland. To my right also is Dr. Bryan Kluck, who is at Lehigh Valley Hospital, a well-known, very experienced interventional cardiology, and also the course director of this meeting right from the very inception of this Congress. And to my left is Dr. Thomas Zeller, a world-famous angiologist from Bad Krozingen in Germany, also one of the course co-director for C3 course, and from the very inception he has been instrumental in guiding us with the endovascular program of this meeting. So it's a tremendous exciting news to have 15th year anniversary of this meeting next year. And Bryan, I want to go to you first. And while we are preparing for this momentous occasion for this meeting, this year we had 1,400 participants, 600 faculty, over 1,000 presentations. So we have seen exponential growth of this meeting. What to expect in the next year's celebratory Congress?
I have to say, Raj, I don't know what to expect. And I don't know what to expect because if you'll remember when this Congress started with less than 50 people coming to the first meeting, to see that this meeting has grown to the extent that it has is unbelievable, astounding, beyond belief. And so, to be honest, what you have up your sleeve for 2019 15th year anniversary, one can only hope to imagine and probably can't.
Well, it was incredible to see. It was so moving, Dr. Shawl, to listening to your presentation today about catastrophes in cath lab. It almost made the audience cry that what actually can be done, for our patients when they are crashing so much. And I think that we're going to really, up the game next year.
Oh, absolutely.
From where we are.
Absolutely. I think I remember your first meeting in Harrisburg with few people and few real demos, and to a phenomenal crowd this time, and as you said, 600 faculty member. I mean, this is phenomenal. Your meeting has grown up, and as I said yesterday, that each time I come here, I go back with something new. I've learned something. So it's a great meeting for anybody, especially in those who are in the Interventional Cardiology Fellowship, to have this meeting. And also it helps when they appear in the interventional boards, because we have got here evidence-based medicine that is very important for newer interventionalists to come to this meeting.
So now let's, Bryan, talk a little bit about some of the nitty-gritty stuff about the meeting next year. So we see a tremendous growth of general cardiology. We see a tremendous growth of venous. Absolutely. We see a tremendous growth in hands-on sessions. We see a great interest in debates. I think that we're going to expand further. We're going to go from 2 days of general cardiology to 3 days, 2 days of venous program to 3 days, to really make it comprehensive and be accessible, material for physicians, those who are interested in specific areas, so that they could come to the meeting and they said, okay, I want to take a deep dive in venous intervention, for example. We could do that. And Dr. Zeller is also going to help us, with the endovascular program. We're really going to take the endovascular program to the next level. And he has great ideas about what to expect for 2015 for endovascular program. So Thomas, give us a highlight on what to expect for endovascular next year.
Well, first of all, it's amazing how this meeting developed. When I remember back to the first editions of a local meeting, now you are organizing a global meeting, which in content is on the same level as TCT, as PCR. It's not yet as known internationally as those major meetings, but you are in a good way to develop an overall comprehensive course covering all segments of cardiovascular disease treatment. And regarding the peripheral course, well, what we would add on to the already very comprehensive and covering program is some more discussion culture, like it's known from the Charing Cross meeting in London. And as I'm involved in the program organization of Charing Cross, we would like to organize a session next year where we would transport this kind of discussion culture into this particular meeting. So we will organize a session dedicated to discuss pros and cons of currently accepted and evolving treatment modalities.
That is a fantastic idea, because today we saw this morning as well as yesterday afternoon, there is so much interest in pro and con debates in the current and evolving concepts as well as some of the controversies. So thank you very much for doing that. In addition to that, we are going to continue to grow our CLI program. We had Dr. Graziani this year who did a hands-on session on plantar loop reconstruction. That technique is not completely new, but still many US physicians, those who are doing CLI procedures, are not going very far into the foot and revascularizing these patients, so that was very helpful. We also had several hands-on sessions with atherectomy devices. That's going to be expanded even more next year, along with some new innovation. And the last thing I like to add is that we really are going to focus on some of the new science. So we have added this year on late-breaking clinical trials. We're going to continue to expand and work on that even further for both our coronary and structural content as well as our endovascular content. So we can bring the latest science to our attendees at our 15th year anniversary meeting. So thank you very much, gentlemen, and we look forward to having you again next year, and have a great day at C3 in Orlando.
Thank you, Raj.
Thank you, Raj.